has shown results. We say we can do 13,000 a day, then we need to start doing 13,000 every single day.
A call to action from the Premier. Doug Ford wants to see a big increase in COVID-19 testing. As we first told you last night, with concern over COVID-19 increasing, testing for the disease has actually been decreasing in Ontario for more than a week. Calling that unacceptable, today the Premier said the province will immediately ramp up those numbers. Our Queen's Park reporter Mike Crawley has been following this story for weeks now. He has an update on the situation tonight.
Questions have swirled for days about why Ontario is testing so few people for COVID-19. The answers have rarely been clear.
We are increasing our testing, particularly in areas that are most vulnerable.
We continue to work at that to understand.
Ontario has tested a far smaller portion of its population than anywhere else in Canada. The province did not test more than 5,000 people on any day this week, even though labs now have the capacity for 13,000 tests a day. It's prompting questions all the way up to the Prime Minister.
We're working very closely with all provincial health authorities to ensure that they have the equipment and the ability to do as many tests as possible.
No, my patience have run thin.
Premier Doug Ford has now had enough.
And no more excuses. It's unacceptable. We need to start doing 13,000 every single day. I want to see every single long-term care facility tested, every patient.
Ford was asked repeatedly why Ontario's testing has been lagging.
I'm not going to look in the past. We're going to learn from the past mistakes and we're going to move forward. And I know moving forward, that testing is going to be ramped up.
At the dozens of assessment centres set up by hospitals around the province, people with symptoms are being denied testing. That's what happened to Katie McLean's husband.
They did assess him and said that he had symptoms consistent with COVID, but they told him that they were essentially testing healthcare professionals and anybody who needed a test to return to work. So he didn't get tested that day.
Today, assessment centres like this one are next to empty. People with symptoms say public health workers and family doctors tell them not to bother going because only frontline healthcare workers, hospital patients, and nursing home residents are getting tested. The health minister says that will change.
We are able to ramp up our testing. We are able to expand the assessment of people that will be tested, and we are going to implement that plan right away.
Mike Crawley, CBC News, Toronto.
There is a mounting death toll tonight from a COVID-19 outbreak at the Seven Oaks long-term care home in the Nielsen Road and Ellesmere area.
There are 45 confirmed cases of COVID-19 and 56 probable cases amongst the total 249 residents at this long-term care home. 16 COVID-linked deaths and an additional 4 deaths in this home, for which the cause is still under investigation.
The Villa adds there could be more deaths in the days ahead. There are also 13 confirmed cases among staff at Seven Oaks. The city says the rate of new infections at the home is starting to show, likely because of measures that have been put into place to limit the spread of the virus. An investigation is also underway because Seven Oaks was one of the homes where faulty masks bought by the city were used. A long-term care home in Hagersville, south of Hamilton, is dealing with a massive outbreak of COVID-19 amongst residents and staff. More than 60 people at Anson Place have contracted the virus.
As their parents get older, grandparents get older, you know that they may not have much time left, but you don't think that they're going to be caught up in a global pandemic.
It's really stressful. I mean, it affects everything you're doing. You know, you're at work, you're doing your thing, and then you're just, you know, a Facebook news pops up that there's another outbreak, and you're aware of what's going on in Bobcaygeon, and you know what's going on in Scarborough and Stony Creek and St. Catharines and all these places, and Anson's right up there with them. You know, this is a really serious. They're very good at managing outbreaks, but this is not outbreak. This is beyond.
According to Anson Place, there have been a total of 8 deaths related to COVID-19. 42 residents and 22 staff have tested positive. The medical officer of health says many of the cases seem to stem from a local funeral. The home is trying to recruit more workers and volunteers to help keep the outbreak contained. At St. Clair O'Connor Community in Toronto, 4 residents have died, 13 more have tested positive, and 10 staff will have the virus. Now, the outbreaks have led a Toronto hospital to offer up extra supports to help nearby homes. Talia Ritchie has that story.
When you have people that are pressured, and when you have the sickness in your staff, people panic.
Everyone knows each other at St. Clair O'Connor Community Long-Term Care Home, where there are only 25 beds. The losses there have been felt deeply.
It is, it's like a family.
But some of the panic has subsided after receiving help from Michael Garron Hospital. A team of doctors and specialists have been providing extra support to East End long-term care homes. Dr. Jared Rosenberg is a geriatrician.
We essentially reached out through telephone and email to the directors of care at the 8 long-term care facilities here in the Toronto East area. We spoke with medical directors as well and other staff and asked, how can we help?
They've delivered personal protective equipment, sent nurses to help hydrate sick residents, disinfected rooms and belongings, and educated the community on preventing spread.
We hope that some of these relationships that we built will grow and will flourish well beyond the COVID pandemic.
And these days, the relationships mean a lot more than just professional support.
They give you advice, they tell you that, you know, we're going to get through this together, and they've been incredibly good. I don't know what we would have done without them.
In a statement, Ontario's Ministry of Long-Term Care says homes should be in touch with local hospitals about any outbreaks, including how many residents are in the facility and how many might need a transfer to hospital. Talia Ricci, CBC News, Toronto.
The federal government is making some changes to its financial help plan for Canadians. That includes adjusting the requirements for the wage subsidy program and adding more money to the student summer job program. The subsidy plan still needs to be passed by Parliament before it can go into effect. Julie Van Duzen now with the details.
Businesses are trying to ride out COVID-19, trying to survive till the deadly pandemic finally lifts. And that includes airlines. Today, Air Canada announced it would rehire the 16,500 employees it laid off last week by tapping into the government's wage subsidy program once Parliament approves it.
It's great news to see the fact that Air Canada has retained these employees. That was the exact intent of the wage subsidy.
The government says it will make the wage subsidy more flexible. Justin Trudeau says businesses can now qualify with a lower revenue drop last month than the one that was first announced. That will mean more businesses can benefit. More employees will be kept on the payroll. That's more chance the economy won't tank completely.
The absolute objective is to make sure that we have all the tools that we need to prevent that recession from becoming a depression.
The opposition says the need is urgent, that the U.S. government has been much faster with its financial aid.
If these businesses go bankrupt, you will see millions of people forced to go to food banks. Many will become homeless. There will be an enormous increase in poverty.
As for the millions of employees who have been laid off so far, they're rushing to tap into benefits that are newly available.
To date, we have processed 3.87 million total CERB claims. This means since March 15th, millions of Canadians would have seen and will see their first CERB payment of $2,000.
Also today, the government announced changes to the Canada Summer Jobs Program. It will boost the wage subsidy up to 100%. It says that will help create up to 70,000 jobs for young people in essential services, about the only kind of jobs that still exist in this pandemic. Julie Van Dusen, CBC News, Ottawa.
Meanwhile, the first payments for the government's emergency response benefits are showing up in people's bank accounts today, just 2 days after the program started. Now, some people thought they were being paid twice, but as Mike Wise explains, that is not what is happening.
More than 1 million Canadians signed up for the CERB program Monday, with many finding their first payments of $2,000 in their bank accounts today. But some tweeted they worried they were being paid twice. The head of the Treasury Board says this could all come down to timing.
There are Canadians that have received a retroactive payment dating from March the 15th, because that's when the benefit can be applied. So from March the 15th to April the 11th is the first 4-week period.
That second 4-week period begins next week, so those double payments might include that check arriving early. But be warned, the next check won't be until May.
Everyone needs to manage his or her budget on the understanding that it's $2,000 per month, regardless of when that $2,000 is actually deposited in his or her bank account.
The payments are meant to help out people who've lost income because of COVID-19. To qualify, you must have gone without income for 14 consecutive days in a 4-week period. But be warned, you'll have to pay income taxes on that money next spring. Some Canadians report getting both CERB payments and EI payments. Now that's likely a mistake since you can't get both at the same time, meaning at some point one of those checks will have to be returned to sender. Mike Wise, CBC News, Toronto.
Today, the city of Mississauga laid out its finances, saying the pandemic could create a deficit of up to $100 million, depending on how long the measures last.
The reality is, unlike the feds or the province, municipalities are not legally permitted to run deficits. We get 60% of our funding from the property tax. The other money comes from revenues from our transit and recreation. My message is clear. Cities do not have the revenue tools or the fiscal firepower to get through this on our own.
Mayor Crombie says the city will have a $59.1 million deficit. The city is asking both the provincial and federal government to step in to help municipalities deal with the recovery process of this pandemic. Now, the city of Mississauga also announced it would be canceling all events and large gatherings in the city until July 3rd. That includes Canada Day celebrations. The city says it will provide refunds or credits for those events or reschedule them whenever possible. It is a stressful time at hospitals right across the GTA, and Toronto police are alleging what a man did this week unnecessarily added to that anxiety. Investigators say this man placed a package in front of an entrance at St. Michael's Hospital early yesterday morning. The package was made to look like a bomb. Because of this, there was major disruptions at the hospital, and ambulances had to be diverted to other hospitals while police investigated. If you know this man, police would like to hear from you. Now, throughout the outbreak, we have been profiling some of the people who are working under dangerous conditions to keep us healthy. Tonight, we are looking at the critical job of respiratory therapists. Alicia San spoke with some of these frontline healthcare workers about their role and how it's changed during COVID-19.
The ventilators don't run themselves.
So we'll look at pressure.
It's a respiratory therapist's job to keep you breathing.
Once it goes into the patient, it fills their lungs, and then they blow it out through this white line here, which goes into N100 filter, or any sort of particle, virus, infection gets filtered out in there, and then the flows are measured through this flow sensor. From
there are 3,700 respiratory therapists in Ontario, and since the influx of COVID-19 has slammed the healthcare system, these specialists have been working round the clock. The job is the same, but the demands are different.
It's not something that's new to respiratory therapists. We respond to cardiac arrests and we respond to emergencies all the time to do with the airway. That being said, when we're looking at COVID, it's the unknown. So we're really actually concerned about how do we ensure that we're giving the patients the treatment they need without risking infecting others. So our colleagues, as well as the rest of the healthcare professionals in the room.
The more information we have. So that goes for intensive care units to birthing rooms.
We're using proper PPEs within these deliveries, within these ORs, just to ensure safety for staff, for mom, for baby, and for everybody, to be honest. So it is an additional level than just a regular delivery, for sure.
There's obviously home visits from respiratory therapists are more often conducted by video calls these days.
So if I had a elderly patient on the phone, I would also ask about additional things that maybe I might not have before, making sure that they have access to reliable housing, make sure they have access to their medications. Maybe someone's lost their job and they can't afford their inhalers. So I would try to get them samples of inhalers or something like that. So it's an all hands on deck situation, but in a different way.
The province has increased its supply of ventilators. Ontario ICUs now have nearly 2,000 beds equipped with one. But it's not just the breathing machines that are needed, but their parts.
This equipment here that gets thrown out is considered consumable equipment, and that's one of the concerns in the RT community of being short on equipment like this. Ventilator tubing, humidification, and filters. They're important in protecting staff going into these rooms while these ventilators are running, and they're a necessity as well with treating these patients.
Take it from them.
We're the ones who are specialized with the ventilators. We are the ones who help insert and assess and maintain the airways.
While the government scrambles to secure more ventilators and our respiratory therapists work with what they've got, they ask one thing from us.
The best thing you can do for us is stay home. I understand that it's being bored at home. It's not going to be ideal. A lot of our patients wish they were in that situation, but they're not, and at the other side of the door.
Ali Chiasson, CBC News, Toronto.
So, Colette, can we use up all the cloudy days like today now while we're in isolation and just save the sunny days for later when we're out again?
I know, it's been kind of crazy, right, Dwight? We've had some days where maybe it starts with clouds and then we get all this sunshine, but you're enjoying it through the window kind of thing. That's the only way to do it. I wish we could do it that way. You know, there does come a time in the spring where I do some maintenance with the weather computer, and I take out the wind chill maps and I go in on my precipitation maps and I take the legend off that has snow and freezing rain and I put in ones that are just about the rainfall. That point in time, we're not there yet. That's what I'm trying to tell you. We've had some mild days, a few of them in a row, but some cooler air is going to move in and maybe some flurries as well. So hang on to this. I wish we could. 14 degrees was the daytime high today, and we're still sitting at 13. So it's mild into the evening hours, and we stay dry for a little while yet. But have a look at what's coming, pushing across Michigan. This is some heavier rain that's going to move in, or at least at times in the overnight, the precipitation will be a little heavier. It'll start out as showers before midnight, then the odd thunderstorm again tonight. Possibility is there, but what really happens is as this cold front goes through, the temperatures are going to drop off, and what's left behind may turn into a little bit of mix or even some light flurries into tomorrow morning. Before that moves out, we'll get some of that sunshine and then even a little bit of lake effect possible with some flurries coming back, and that would be Thursday night into Friday. So overnight tonight, 3 degrees, becoming windy, and tomorrow, Dwight, just 7, but we'll get some sun in there at some point.
Hopefully. Thanks, Colette.
You're welcome.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
Homeless advocates are calling for an increased response from the city after a person inside Seton House, one of the city's busiest shelters, tested positive for COVID-19.
There are shelters all across the city, not just an isolated one, but all across the city, that are not allowing proper physical distancing. There has been no directive from the medical officer of health ordering shelters to separate cots or mats by 6 feet.
The city must rapidly move homeless people into hotel rooms and into housing. In terms of examples of housing that they could just take over right now, there are 5 provincially owned and city-run big houses that sit on Spadina Road just north on Bloor, vacant.
Advocates say it has been more than a week since the city announced it would move homeless people into hotels, but they say that hasn't happened. Toronto's medical officer of health confirmed this week that a man staying at Seton House has COVID-19. That man and a person he shared a room with are now in self-isolation. The city says 20 people are being moved out of Seton House into hotels and other facilities to ensure physical distancing, and that enhanced infection prevention and control measures are in place to protect residents and staff. The provincial government is ramping up its inspections of workplaces. It wants to make sure people who have to work are being kept safe. Lorena Redekop has more on that story.
This will be turned into a temporary pandemic response unit. It used to be a parking lot behind the Mississauga Hospital. Supposed to be finished by the end of April. The province announced any critical construction will no longer be subject to noise bylaws and can run 24/7.
That will obviously have some impact potentially on people depending on where those projects are located, but I think most people would understand the need for us, especially in these circumstances, to proceed.
The Premier gave a shout out to all people still on the job.
This period has been hardest for our essential workers. I know it's causing anxiety for them and their loved ones, but I want you to know that Ontario recognizes your sacrifice.
Construction sites are one of those essential workplaces where employees have complained, whether it's due to no proper hand washing facilities or a lack of physical distancing. The province announced it's ramping up its workplace inspections, and it put out a call to any recently retired inspectors to come back to help out.
Our inspectors are going into places to investigate problems, places where workers think they're in danger. They're sorting those problems out, working with employers and employees and encouraging parties to work together. Where warranted, they're shutting workplaces down.
The government also says it's doubling its health and safety call lines to 50. That's where workers can complain. The phone number, 1-877-202-0008. Lorenda Redekop, CBC News, Toronto.
At the stroke of midnight, an extravagant light show marked the end of a 76-day-long lockdown of Wuhan, China. We take you to the one center of the coronavirus outbreak for what life is like now after the break. Exactly 100 days after the first alarm over coronavirus was sounded in Wuhan, the Chinese city of 11 million is now emerging from lockdown. Finally, residents are able to leave their homes, albeit under strict measures, while others are rushing to leave the area altogether. Patrick Falk explains from Beijing.
Well, in the words of an epidemic control official from Wuhan, just because the lockdown is being lifted, it doesn't mean that the city has got the all clear. And it also doesn't mean that they're easing up on restrictions necessarily. So what's really happening in Wuhan is that people there are going to have to face the same sort of measures as most of the country is facing right now. So they'll be continuing to wear protective masks. They'll still need to keep their distance from one another. And of course, authorities have still been urging people to remain at home as much as possible. But this is nevertheless a huge step for the city of 11 million people. They have been under a lockdown for a total of 76 days. And remember, a lot of the people that have been stuck there don't even come from Wuhan. So they've been absolutely desperate to leave the city for more than 2.5 months. So yes, there have been celebrations and there was a big light show last night, but really just a lot of relief from people that this lockdown is finally being lifted. But of course, there are still restrictions in place for people who actually want to leave the city. They will need to carry around a certificate and a QR code showing that they have a clean bill of health. Of course, they need to remain vigilant, and authorities are making sure that they are doing everything right now to stop the spread of the virus to other parts of the country. There's a massive amount of people that have left Wuhan today. According to the China Railway Corporation, 55,000 people, they estimated, have left the city today. So there is a mad rush leaving the place today, and no doubt there will be more people to follow in the coming days, and they just need to keep an eye out for these asymptomatic carriers in particular, which is causing a lot of concern right now.
This might look like a basic box, but this design from a team of entrepreneurs and clinicians in Toronto could help protect healthcare workers across the country from COVID-19. I'm Lauren Pelly, and we'll have that story coming up.
Amid growing concerns over shortages of personal protective equipment, a team of Toronto clinicians and entrepreneurs have developed a new way to protect healthcare workers. It's called the COVID Box, a simple device to shield frontline staff during one of the most dangerous procedures. Lauren Pelly shows us how it works.
The box starts out flat and only takes a few minutes to build. It's made out of polycarbonate and zip ties, making it sturdy and easy to clean between patients.
This is really just a simple box that we put around a patient during a high-risk procedure.
Well, this is the open hole, so we're just trying to protect it to cover up as much as possible, not create a full seal, but keep it relatively closed so aerosol can't come from this way.
This shield offers some protection to clinicians while they're inserting a breathing tube.
This is where we would come through with these armholes, and we would intubate the patient from here.
Inspired by designs from a doctor in Taiwan, a team of local physicians and entrepreneurs developed the box just last month. It costs around $200 to build.
So we've made about 20 to 30 prototypes. We've been able to get at least one box to most GTA hospitals.
The first prototype I made was very rough. I was using hand tools like a hacksaw. And then John built the computer designs for this one, which is actually made by automated machines.
We're looking to start shipping them to other hospitals within Canada and the US this week.
The team hopes through crowdfunding and corporate donations, they'll be able to get these boxes into hospitals around the world.
The mantra of emergency medicine is do what you can with whatever you've got, and so I think that's kind of where we're all trying to do that.
Lauren Pelly, CBC News, Toronto.
Ontario has passed an emergency order to temporarily allow legal cannabis retailers to reopen. It means they can offer curbside delivery and pickup service at one Brampton pot shop. They're trying to figure out how to carry out business within these new guidelines.
Curbside pickup and delivery was previously prohibited. We weren't allowed to do these things. Now figuring out a sort of a proper way to maneuver the regulations given these two new avenues to distribute the product. I think that is where the real challenge becomes apparent.
Last week, cannabis shops like Ganjica House were forced to close after being taken off the list of the province's essential businesses. Now they are getting ready to reopen, but under very different circumstances. While offering pickup and delivery, they still have to ensure people who are intoxicated aren't being served. They also have to make sure customers are of legal age. Ganjica House's owner thinks cannabis stores should have been allowed to stay open and operate under the same rules as places such as the LCBO. They are some of the stars of this pandemic, the truck drivers who are delivering the food and supplies needed to keep society running smoothly in a crisis. And today they received a small token of appreciation for their work.
All 23 en route locations across the motorway are offering a free medium beverage to our trucking community. It's a small token for us to say thanks to keeping our supply chain moving.
En route locations have been deemed an essential service during the outbreak. We talked with some of the drivers who stopped in today. For them, having somewhere to pull off the road and take a break is critically important at a time when so many places are closed.
We work in a 14-hour window where we start our day and stop our day, and we need at least 8 to 10 hours rest, and we got to find a place to get our rest. And if places like fortunately, en routes are still open.
I heard of this by a trucker, and he says, "Oh, if you stop over there on a 400, they serve you and you have free coffee." I go, well, I gotta stop because I'm gonna be on the road for an hour or so.
Some of the drivers some of the drivers we talked to say during this pandemic, things haven't changed that much for them. They spend most of their time alone in their vehicles and usually only make brief stops to get food or gas. They are busy out there helping us. It's an issue some of us have been dealing with recently. With nowhere to go to have your hair cut and styled right now, many hairdressers are turning to the internet trying to help their clients out virtually. Greg Ross explains.
It's an issue many of us have been dealing with lately. Bad hair. The problem is you can't just go out and get a haircut during this global pandemic. Instead, many people have resorted to cutting their own hair, some even posting videos and pictures online with varying results.
It's the new look. Tiger King, eat your heart out.
Me, on the other hand, I've just continued to try and style my hair the way I always have, which is getting increasingly difficult. I have finally decided it's time for me to get some help. And that's where Sharon Hussey comes in. Sharon, you're a hairstylist in Yorkville. What have you been doing the last few weeks?
Well, I've done a lot of binge watching TV shows. I have done a lot of cooking.
You've also been helping some of your clients and some of your friends to do their own home haircuts?
I have. I've had a few friends reach out to me saying that their husbands or their sons desperately need haircuts, and so they've asked if I could help them kind of walk through a basic men's haircut, which I think is hilarious and like happy to help.
Maybe I could try like the Jim Carrey, from Dumb and Dumber. So you're telling me there's a chance? Yeah! I'm a little nervous about cutting my own hair. What do you think I should do here?
You can definitely trim around the ears just to keep that kind of clean, but I would suggest a longer hairstyle product, and a blow dryer can go a long way.
I don't have professional scissors to cut my hair. All I have are these scissors that came with my dog grooming kit, and I used them to cut my dog Oakley's fur.
That'll work.
All right, here we go. You ready?
And you're just gonna trim around the ear.
Sharon, I'm doing it.
Good job. And then just pull your ear flat.
I'll pull my ear flat.
Right behind it.
Yeah.
That way you have the opportunity to get the hair that's behind your ear.
This side seems harder. Oh, I just about cut my ear off there. Does that look a little better, do you think? We got the sides trimmed out. Let's try and style this hair now.
You're going to take just like a nail tip amount of product. You're going to emulsify in your hand.
All right.
And then you're going to run through your hair back and forth. So you're going to go one side, and then you're going to go the other. And you're going to place it how you want it to sit.
It kind of looks exactly like how it did before.
And then you can take your hairspray and just spray the top section into place.
I'm going to be coming to see you as soon as this is all over to fix this mess on top of my head.
I'm hoping in the next few months we'll all be back to work.
Oh, I think a lot of people are hoping they'll be back to work now. Call it my barber, Shane from Blade Runner. He's a regular viewer. He'll let me know if it's getting, a little mini afro here and I need a cut. But he's an artist. I can't do what he does, even with virtual help, call it. No.
I know. It's such a talent, and we can take a stab at it, which is kind of what I did. Speaking of our dogs, I didn't know who to do first. I needed to do my sweethearts, but do I practice on him and then do the dog, or do I practice on the dog and then do his hair and beard? So here's how it turned out on the dog. Anyway, we'll show you that. This was the before, Dwight. You know Tia. You've met Tia here on the show.
Viewers know Tia, yeah.
Yeah, and then, now, come on. Not so bad, right?
We'll give you I'll give you an 8.
Okay, well, she gave me a worse mark than that because Tia gave me a B+ because she's still got some of these Grinch fur, the fur around her paws.
Well, you didn't show me that picture. I'm with Tia. Yeah,
I know.
we'd have to take off some marks, call it.
Yeah, and then there was the epic fail, which
the
is
fail at the tail, yeah.
She would lie on one side, Dwight, so I got that side, but I couldn't get that side.
Gosh.
She's
Folks
still
at home,
walking around like that.
Don't try this, please.
Yeah, don't try this at home. We need our professionals back. There are so many things we're all going to be looking forward to. And there's one more thing. Okay, not essential, but to some of us, yeah, we think about how essential. We miss everyone. All right, a look at our current temperatures here. Still holding on very mild, 13 degrees in the city, 14 though for Hamilton and St. Catharines. You're at 14 as well. We're into these dry conditions, a little breezy out there, but it's going to get breezier. The winds are going to get stronger as this front comes through. So that rain that's back in Michigan, that's going to move through as we get closer towards midnight. The showers develop, well, say after 10 o'clock or in that corridor, and then some heavier rain in the overnight. And then as temperatures cool down in the morning, yeah, maybe even a few flurries coming through the GTA. I said it, I'm sorry, but it is possible. Windy day tomorrow. We'll get some clearing, so we'll get some breaks and some sunshine coming back, but windy enough that we may see some squall-like setting up that condition may bring some of those flurries back into the GTA Thursday night into Friday morning. So temperatures coming down a little bit, and as I say, certainly some windier conditions. We'll see tomorrow some of those winds from the west gusting over 50 kilometers an hour. Tonight, though, Dwight, our lows going down 3 to 4, and I'll just leave you with a quick look, and I'll also tweet this out, by the way, so you can have a longer look at your 5-day forecast and what's coming for the Easter weekend.
After what you did to Tia, no more dog hair cutting. Thanks, Colette.
Yeah, I'm done. That career's over. Sticking with weather.
This weather update is brought to you by Fairmont Le Chateau Frontenac, the best location for your next spring break getaway in Quebec City.
Shortages of personal protective equipment continue to worry healthcare workers. This week, the Premier gave a stark warning. Our supplies are getting very low. So just how much protective gear is needed? University Health Network's Beata Sander is one of the scientists who projected numbers in a report released just today. So, Beata, let's start with the numbers. What did you find?
Staggering numbers, to me at least, right? So we did predict numbers of personal protective equipment in terms of bundles. So usually you need some kind of bundle of different types of equipment. And so depending on the type, it's different numbers, obviously. So, so surgical mask, we looked at 10 days out from yesterday. And so it's around 3 million for the next 10 days.
Wow.
10 million for gloves. So I guess about 1 million a day over the next 10 days. Face shields, 3 million, something like that. So it's huge, huge numbers.
How did you come up with those figures then?
So what we did, we used a mathematical model to predict what are the number of patients per day in the hospital in the different type of locations, in terms of ward, ICU, emergency department, ICU without ventilation, whether they are COVID-19 positive or waiting for their test results or are tested negative already. So once we know what are the number of patients in the hospital at a given day over the next 10 to 30 days, then we kind of think about what type of healthcare workers are taking care of a particular patient over a 24-hour period. And then you think about the touch point. So that's something I learned. So a touch point is when a healthcare worker provides care to a patient and needs personal protective equipment.
Now, when you looked at these numbers, did you also factor in the peaks and the valleys of this COVID fight?
Yes, absolutely. So that's why we needed to predict number of cases over time. So we predict that number of cases or patients that are admitted to the hospital are still increasing a bit over the next little while and may level off over the 30-day period. So we predicted out for 10 days and then also 30 days.
There was some feeling in the beginning of this fight that people felt that if the public was out there wearing the masks and the gloves around every day, that we might not have enough left for our healthcare workers.
It really depends which type of PPE you're looking at. So surgical mask, absolutely. So if everyone is using it, then it may not be enough for healthcare workers. Other types of PPEs, I would think, is not generally used by the public. So kind of really depends what type of PPE we're talking about.
And finally, were you surprised at all by these numbers that we would need that many?
It's, going into this, I had no idea, honestly. So to me, it's just staggering. Just so huge. The numbers are really, really big.
Thank you so much for doing this. Beata Sander is a scientist with the University Health Network. Thanks for your time today, Beata.
Thanks so much.
Now, while staying at home is important, so is staying active and getting some fresh air. An independent seniors home is trying to find a happy medium, offering a fitness classes that their residents can take right from their balcony. Take a look.
What we're doing today is we're trying to do a little bit of exercise with our seniors, independent seniors who live in our 3 apartment buildings. So today we decided we would put together this athletic piece, have them do a bit of stretching and exercising, get some fresh air, and see that the community supports them and the whole organization supports them for what they're trying to accomplish. The people behind us are people from our athletic facility. They're volunteers and their instructors have decided to come out today and go to this building and our other 2 buildings and share some fun and some exercise with all of the seniors.
cha-cha-cha, mambo, cha-cha-cha. Oh, we had a great time. It was absolutely fantastic. This is one building. We're going to be doing 3 more buildings, both sides, hopefully, because they don't all face on the same side. But yeah, it was wonderful. We're having a wonderful time today. We had at least 20 or 30, but looking out the balconies and all moving their stuff and having a great time.
Yeah, I move a little bit because I'm here, but I have a good time because of the music put you up. Nice. I stuck inside. What do you do? It is, but it's very nice what he done today. Yeah. Very, very nice. Yeah.
3, 2, knees up. 8, 7, 6, 5, 4, 3, 2, let go.
We've got about 700 seniors in about 650 apartment buildings. It's a great way for them to get outside, get a little bit of fresh air, see that everybody's out here supporting them, encouraging them to continue to follow the precautions, and we'll get through it. We really will.
You're saying that silver solution would be effective?
Totally eliminate it, kills it.
I mean, if you tell someone to drink chloride bleach, I mean, that is really bad for you.
After the break, Health Canada starts to crack down on so-called crackpot remedies for COVID-19. Fear over the coronavirus has people making some wild claims online about cures and treatments, none of them scientifically proven, some of them even dangerous. Now Health Canada is starting to crack down. Here's Katie Nicholson with CBC's COVID Check team.
You're saying that silver solution would be effective.
Totally eliminate it, kills it, and deactivates it.
This hard sell for a bogus COVID-19 product got Faith TV in trouble with Health Canada. The Canadian TV station received one of 27 compliance orders from the federal government warning about making unproven claims about COVID-19. There were orders to naturopaths and natural medicine stores, to a woman who offers lip injections selling face masks, and to the big players too, companies like Canadian Tire and Amazon. The online retailer received several orders for products being sold that made unauthorized claims about COVID-19. Even Radio Canada was called out for an unverified claim on one of its online stories, which it has since fixed.
I like the fact that they're going after the range because we're seeing misinformation and inappropriate marketing absolutely everywhere.
But pseudoscience critic Timothy Caulfield would like to see tougher penalties for health misinformation.
You know, I'd like to see fines. I'd like to see providers that are regulated stopped from making claims and providing unproven treatments.
The pandemic has prompted a wave of health misinformation on everything from diagnostic tests to home remedies.
I mean, if you tell someone to drink chloride bleach, I mean, that is really bad for you.
Senator Stan Kutcher is pleased the government is cracking down on bad COVID-19 information, but he thinks people also need to take responsibility for themselves.
Come on, Canadians. We've also got to up our game to become more science literate, more health literate, so we can separate fiction from fact.
Health Canada says it will continue to monitor websites and work with retailers to remove false and misleading claims. Katie Nicholson, CBC News, Toronto.
After the break, today's Frontline Hero. Stick around for that. We're coming right back. We can only imagine what it's like for frontline workers each day selflessly jeopardizing their own safety to help others. It is especially difficult for the family of some of those workers knowing their loved ones are being called to do essential work. So tonight we have a special tribute to a doctor from his brother. This is Dr. Thomas Dashwood, a resident doctor of internal medicine at Mount Sinai Hospital. His brother Kit wrote to us saying this: he always fights for the little guy, advocates for the marginalized, and is now fearlessly fighting COVID-19. Even after he is done his long shifts, he will always have time to answer our family's questions, explain the situation, and offer advice. Kit says each night at 7:30 p.m., he also joins thousands in a special salute to healthcare workers from his Fort York balcony. Thank you for everything you're doing, Dr. Dashwood. If you'd like to share a story about your frontline heroes, send us a selfie-style video explaining why they are a hero to you. Email us at torontotips@cbc.ca, tag us on Twitter or Instagram at CBC Toronto, or send us a message on Facebook. We just can't stop applauding these people in this fight and what they're doing out there every day, Colette.
Absolutely. I'm thinking I need to get a cowbell up in here
Yes.
in the Weather Center, and we come out of that segment, I'll be winding that up. Let's go over what's happening this evening. So it's pretty quiet as we go into the next few hours and 11 degrees, but as we're approaching midnight or getting after about 10 o'clock, as I've been saying, we are looking at rain developing at times in the overnight. It'll get a little heavier, getting breezier as the front passes through, but in the early morning with that colder air working its way in and a little bit of moisture still in place, we may see some flurries coming through the GTA. So note to self, don't be surprised if there's some of that white stuff flying in the early morning hours. Tomorrow afternoon, a cooler day than today, so 7 degrees, and we are looking at a mix of sun and clouds, so we should get some breaks in the cloud cover there into tomorrow afternoon, but it's going to be breezy, so that 7's going to almost feel a little cooler than that. I do just want to show you, we didn't have a lot of time for the 5-day forecast earlier, so I do want to show you that as we go into Friday morning, again, with that low Thursday night into Friday, a few flurries also possible. Breezy still Friday, not as bad. Mostly cloudy and still a chance for precipitation. But Saturday, as we're getting into the weekend, 9 degrees, Easter Sunday, 10. Rain showers developing, though, so the temperature's coming back up. But we are looking at some rain coming back at us again there Easter Sunday into Monday, Dwight.
Thank you, Colette.
You're welcome.
That is our show for tonight. Thank you for joining us. We will see you back here tomorrow night at 6. Have a good night, everyone. And remember, stay safe.